Hi, my name is Jessica Cook, and I'm a physical therapist and the owner of Koch Physical Therapy. I'm located in Gilboa, Ohio, in the Hovis Chiropractic Building and with Dr. Casey Hovis, who also specializes in pregnancy and postpartum care. I wanted to make a video for providers as well as for potential patients, just so that they could have a little bit more information about what pelvic floor therapy does and what it can help. Because a lot of people aren't aware that, you kind of hear the thing of, well, I've had babies, so now I leak whenever I run, or I've had babies, so now this happens. And so much of the time people don't realize that even though those things are common, they're not normal. And physical therapy can make a big difference because just like, your shoulder, the pelvis has joints and it has muscles. And just like with the shoulder, we can make sure that the muscles of your pelvic floor are working well to make sure that they're strong and coordinated and able to relax. So physical therapy can make a big difference. So probably the things that we address the most are incontinence, which a lot of people, again, think that it's just something that they have to live with. But incontinence can be treated with a lot of education, looking at the pressure system and core strength, breathing, looking at the pelvic floor to see what's going on there, if there's good coordination and strength. So incontinence is a big thing that we can treat throughout all different ages. I treat kids, I treat adults. It doesn't matter the age. Even though personally I do not have a relationship with Medicare, so I cannot treat Medicare beneficiaries, but other pelvic floor therapists absolutely can. So regardless of the age, you can benefit from some pelvic floor therapy. Another big thing though is pelvic pain. So whether that is, sometimes people have issues with tampon use and they can't tolerate the tampons, or gynecological exams, they can't tolerate the insertion of the speculum. Other times people have pain with intimacy or with their functional activities like running. So physical therapy can address all of that as well. It's a very broad category that we can do a lot to help functionally with people and improve quality of life. So one of the big questions that I get is, what does pelvic floor therapy consist of, or why would an internal exam be helpful? So most people have heard of what Kegels are, that it's that lifting contraction of the pelvic floor. But just like if you kind of think about if somebody's hamstrings are tight, you wouldn't treat that with a whole bunch of hamstring curls, right? So you would want to stretch your hamstrings if your hamstrings are tight, versus if your hamstrings are weak, you want to strengthen those. The same thing works with the pelvic floor. If somebody has a very tight pelvic floor, which could be causing pain, or it could reduce the efficacy of being able to either defecate or urinate. If those pelvic floor muscles aren't able to have that range of motion to be able to relax, we surely don't want to be performing Kegels and making those muscles even tighter. Instead, we first and foremost want to work on lengthening those muscles, getting them to a proper resting state, and then we can work on strengthening them. So that's why it's really important to be able to see what's actually going on at the pelvic floor, to see if, are we dealing with weakness that we need to truly strengthen, or are we dealing with tightness that we need to lengthen and loosen and relax? Other times people are having pain because they have trigger points in those muscles. So just like you can have a trigger point in your upper trap, you can have trigger points in your pelvic floor muscles as well, to where hands-on work and some manual techniques can help a lot with that. So that can make a big difference just doing that. But that can help guide a treatment better as compared to just giving a specific exercise if you don't know what's going on necessarily. And research shows that actually about half of women don't perform Kegels correctly. They think they know what they're doing, but a lot of times they can actually be performing like a bulge movement as compared to a lifting contraction. And if incontinence is the issue, a bulge is going to make those symptoms worse as compared to making them better. So not only do we want to see what would be the best treatment depending on what the deficits are, what's truly going on, but we want to make sure that they can actually perform those contractions. So even if somebody is appropriate for Kegels, we need to make sure that they're performing them correctly and actually doing a lifting contraction as compared to bulging out that pelvic floor. So those are probably the main things that help kind of show what is helpful for a pelvic floor exam specifically. Otherwise, I also specifically treat pregnancy patients. So we can do all sorts of things to help prepare their body for labor and for childbirth. So just like you wouldn't run a marathon without training, labor and childbirth is a marathon. So you want to be able to prepare those muscles, to prepare the pelvic floor, not only for how you can do in labor or during childbirth, but then that also helps recovery afterwards. Speaking of recovery afterwards, we also see people postpartum. So whether you have a DRA or that separation of the abdominal muscles, or if you have leakage or pain or core weakness from carrying a baby for the past 9 months. A lot of people have postural pain from nursing, from breastfeeding, or just need some education for like biomechanics of their techniques. So a lot of that can be addressed in therapy as well. You know, we're not just a pelvic floor, we're not just a neck and back. The whole body is really, really important to be able to address both in pregnancy, afterwards, and any other time of your life cycle. So those are probably the biggest things that would be the most helpful to be able to treat patients. One thing to keep in mind is that personally, I know that this is bridging beyond just pelvic floor therapy, but at Koch Physical Therapy, I am a self-pay practice. So rather than going through insurance, I've chosen to do the route that the patient pays me at the time of service, and then if they choose to submit to insurance, they absolutely can. I provide all the codes for that, and it's an easy self-submit through their insurance website typically. But that allows me to get an hour of one-on-one time with my patients. So, and nothing's, no distractions. We're able to dig into what's going on and truly address the issue. So a lot of the times my plan of cares are, we might see each other once a week initially and then trail off to every other week or every 3 weeks, depending on what's going on. So we're able to address a lot in a shorter amount of time, or being able to at least dial back enough to where they aren't coming, 2 to 3 times a week for 6 to 8 weeks. Because I know that that's just not doable for a lot of people, especially if they're paying out of their pocket. So I think by able to have that one-on-one time with them, that makes a big difference. But that is something that helps. It does make me different than other clinics, to where that's something to keep in mind, as well as the inability to be able to treat Medicare patients. So if anybody has any specific questions about pelvic floor therapy, how that can apply or how that can connect to other types of therapy that we do, or if you're not sure if it could help with certain things, because we can address things like prolapse as well, feel free to reach out to me. I'm an open book. I'll gladly tell you what we can or may not be able to help with. But if you have any questions, let me know. Like I said, it can't promise a fancy video, but I wanted to at least get some information out there to hopefully help answer some questions and kind of let people know what's all possible, because quality of life is so important. And if we can address it, especially sooner rather than later, we might as well try and see if we can get you feeling better. It makes a big, big difference. So thank you for your time. I appreciate it, and let me know if you have any questions. Thank you.